Artificial intelligence is revolutionizing healthcare at an unprecedented pace. From diagnosing diseases to drug discovery, AI promises to save millions of lives and reduce human suffering. But beneath this transformative potential lies a darker reality that the healthcare industry is only beginning to confront. Today, we'll explore the 5 most dangerous qualities of AI in healthcare, risks that could undermine patient safety, deepen health inequalities, and fundamentally alter the doctor-patient relationship in ways we're not prepared for. Imagine you're a doctor, and an AI system tells you that your patient has a 90% chance of developing heart disease within 5 years. You want to understand why, but the AI can't tell you. This is the black box problem, and it's AI's first dangerous quality in healthcare. Modern AI systems, particularly deep learning models, make decisions through millions of interconnected calculations that even their creators cannot fully explain. When an AI misdiagnoses a rare cancer or recommends the wrong treatment, we often have no way to understand what went wrong. In 2019, researchers discovered that a widely used AI diagnostic tool was making decisions based on irrelevant factors in medical images, like the type of scanner used, rather than actual medical indicators. The system appeared highly accurate in testing, but it was fundamentally flawed. This lack of transparency creates a dangerous precedent. How can doctors trust recommendations they can't verify? How can patients give informed consent for treatments based on incomprehensible algorithms? When AI systems fail, and they will fail, the black box problem makes it nearly impossible to learn from these failures and prevent them from happening again. AI doesn't just reflect human biases, it amplifies them at scale. This is perhaps the most insidious danger of AI in healthcare, the perpetuation and magnification of existing health disparities. AI systems learn from historical data, and that data is contaminated with decades of systemic bias in healthcare delivery. If minority patients have historically received less aggressive treatment, AI will learn that this is normal and continue the pattern. A landmark study published in Science found that a healthcare AI system used by hospitals across America was systematically discriminating against Black patients. The algorithm was designed to identify high-risk patients who needed extra care, but it consistently underestimated the health needs of Black patients, affecting millions of people. The problem wasn't intentional racism. It was that the AI used healthcare costs as a proxy for health needs. Since Black patients historically received less expensive care due to systemic barriers, the algorithm learned to associate their lower costs with better health, even when they were actually sicker than white patients. This bias doesn't just affect individual patients. It shapes healthcare policy and resource allocation. When AI systems systematically undervalue the needs of certain populations, they can institutionalize discrimination in ways that are nearly invisible and extremely difficult to detect and correct. What happens when doctors become too dependent on AI? This third danger is already manifesting in subtle but concerning ways across healthcare systems worldwide. As AI becomes more sophisticated and seemingly more reliable than human judgment in certain areas, there's a natural tendency for healthcare providers to defer to algorithmic recommendations. But this over-reliance creates a dangerous erosion of critical clinical skills. Studies in radiology show that when AI pre-screens medical images and flags potential problems, radiologists spend less time examining normal scans. While this improves efficiency, it also means radiologists get less practice identifying subtle abnormalities that AI might miss. This creates a vicious cycle. As doctors rely more heavily on AI, their diagnostic skills weaken. As their skills decline, they become even more dependent on AI. Eventually, we risk creating a generation of physicians who cannot function effectively without algorithmic assistance. The danger becomes acute during system failures, network outages, or when encountering cases that fall outside AI training parameters. If AI systems fail precisely when they're needed most, During emergencies, novel disease outbreaks, or unprecedented medical situations, doctors may find themselves unprepared to make critical decisions independently. Consider the COVID-19 pandemic. Many AI diagnostic tools trained on historical data struggled with this novel disease. Healthcare systems that had become overly dependent on AI found themselves at a significant disadvantage. AI in healthcare is voraciously hungry for data, and this appetite creates unprecedented privacy and security risks that extend far beyond traditional medical record breaches. Modern healthcare AI doesn't just need your medical history. It wants your genetic data, lifestyle information, social media activity, purchasing patterns, location data, and even voice and facial recognition. The more comprehensive the dataset, the more accurate the AI becomes, but also the more vulnerable patients become to privacy violations. Unlike traditional medical records, AI-processed health data can reveal information that patients never explicitly shared. AI can infer mental health conditions from smartphone usage patterns, predict genetic predispositions from family data, or deduce lifestyle choices from seemingly unrelated information. The security implications are staggering. Healthcare systems are already prime targets for cybercriminals, but AI systems present new attack points. Adversarial attacks can manipulate medical images to fool diagnostic AI, potentially causing misdiagnoses. Data poisoning attacks can corrupt AI training datasets, introducing systematic errors that affect thousands of patients. Perhaps most concerning is the permanence of these vulnerabilities. Unlike passwords that can be changed or credit cards that can be replaced, your biometric data, genetic information, and health patterns are unchangeable. Once compromised, they remain compromised forever. The interconnected nature of AI healthcare systems means that a breach at one institution can potentially affect patients across multiple networks, creating cascading privacy violations that are difficult to contain or fix. The final, and perhaps most profound danger of AI in healthcare is the gradual erosion of human judgment, intuition, and empathy in medical care. Medicine is not just applied science. It's fundamentally a human endeavor that requires understanding context, interpreting subtle cues, and making complex judgments that go far beyond data points. AI excels at pattern recognition and statistics, but it cannot understand the full human context of illness and healing. Consider a patient presenting with chest pain. An AI might focus on measurable vital signs and test results, but an experienced physician notices the patient's anxiety, their family dynamics, their financial situation, and their cultural background, all factors that influence diagnosis and treatment decisions. As healthcare becomes increasingly algorithmic, we risk losing these essential human elements. AI can process symptoms, but it cannot hold a patient's hand during a frightening diagnosis. It can analyze treatment options, but it cannot provide the emotional support that is often as healing as any medication. There's also the danger of reduced clinical intuition. Experienced physicians often rely on subtle instincts and pattern recognition developed over years of practice. These instincts have saved countless lives by identifying problems that don't fit standard diagnostic criteria. As AI takes over more diagnostic functions, we risk losing this invaluable human insight. The risk extends to training new physicians. If medical students learn to rely on AI from the beginning of their careers, they may never develop the deep clinical reasoning skills that distinguish great doctors from algorithmic technicians. These 5 dangers, the black box problem, algorithmic bias, over-reliance and skill degradation, data privacy vulnerabilities, and the erosion of human judgment, represent serious challenges that the healthcare industry must address urgently. But recognizing these dangers doesn't mean rejecting AI in healthcare. It means approaching AI with caution, oversight, and a commitment to maintaining human-centered care. The path forward requires several steps. We must demand explainable AI systems in healthcare, algorithms that can provide clear reasoning for their recommendations. We need comprehensive bias testing and mitigation strategies before any AI system touches patient care. We must design AI as a tool to augment human expertise, not replace it, ensuring healthcare providers maintain and develop their clinical skills. We also need strong data governance frameworks that protect patient privacy without stifling innovation. And above all, we must preserve the human elements of healthcare, the empathy, judgment, and personal connection that AI cannot replicate. The future of healthcare will undoubtedly include AI, but that future is not predetermined. By acknowledging these dangers now, we can work to harness AI's potential while protecting what makes healthcare fundamentally human. The question isn't whether AI will transform healthcare. It already has. The question is whether we'll guide that transformation wisely, ensuring that in our rush to embrace the future of medicine, we don't sacrifice the timeless values of healing, compassion, and human dignity that lie at the heart of healthcare. The stakes couldn't be higher. The choice is ours.